Concussions are actually brain injuries. Neuroscientists call them mild traumatic brain injuries compared to more severe injuries such as hemorrhages or strokes, but the symptoms of a concussion can be anything but mild. Visual problems are extremely common after concussion, due largely in part to the extensive nature of our visual brain. Literally 50% of the neurons in our brain play some role in our visual system. Visual problems after concussion are not eyeball problems. There's no damage to the eyeball typically after concussion, but the damage is to the extensive networks in our brain that control what we see and how our eyes move, how we process what we see and how our eyes are doing various movements. A study that Dr. Beckett and I were involved in, along with doctors at Children's Hospital of Philadelphia and Salus University, looked at adolescents after concussion and found that over 2/3 of them had a diagnosis of an eye teaming problem, a tracking problem, or a focusing problem. Over 2/3. So vision problems are extremely common after concussion. 80 to 90% of concussions resolve in about a month. But that leaves 10 to 20% of individuals with concussions that have prolonged problems after concussion. The typical post-concussion symptoms include headaches, blurred vision, double vision, eye fatigue, loss of place, even dizziness and nausea, often associated with sustained close work like reading, computer use. Screens of all kinds are especially difficult after concussion due to light sensitivity and motion sensitivity. Treatment options for post-concussion vision problems include specific lenses, prisms, certain tints can be very helpful for light sensitivity, and vision therapy. Vestibular rehabilitation is sometimes done after concussion, and it's usually done by physical therapists, and that involves some vision activities. But optometric vision therapy is more targeted and more intensive for these prolonged visual problems after concussion, and can be very effective for these problems in helping people return to work, return to sports, return to school. Physicians that manage concussions are becoming much more aware of the role of vision problems in concussion, and it's also becoming more aware of how crucial and important it is for kids as they return to school and return to learn.